For many, it was hard to understand why, up until now, the BC government had only been recommending the wearing of masks in healthcare settings. Hospital wards, the cancer clinic, extended care homes, they are, after all, for the most vulnerable among us. If we had to wear a mask on a ferry, how is it we didn't have to wear one in a hospital? But starting now, masks are mandatory in all healthcare settings. For Sina Muscati, a new parent of very premature and immunocompromised twin babies, the new policy is a relief.
We do need that added step to make it mandatory because we can't really risk the lives of these very vulnerable people who can't defend themselves.
Neonatal intensive care units are home to the most vulnerable newborns. In August, the NICU unit at St. Paul's Hospital had to be shut down after one premature baby was diagnosed with COVID-19. Muscati's babies are at Royal Columbian. He took his concerns to Provincial Health Officer Dr. Bonnie Henry after noticing a few parents refusing to wear masks.
When I wrote to the ministry, they came back to me saying that we all have to be kind and understanding and supportive of each other. And I think they were hoping this sort of voluntary approach would work.
But it's not just hospitals. Places like the BC Cancer Clinic, long-term care facilities and healthcare facilities, programs and services are all now being directed to make mask wearing mandatory, something doctors of BC have been advocating for weeks now.
We're very pleased that this has come down.
Asked why she thinks the BC government waited until now to implement the new policy.
Well, I recognize that there's been a lot of mixed messaging with regards to masking as this pandemic has evolved. Now we know a little bit more and enough to know how we can protect those around us.
Calling masks just one more tool in the toolbox, she says we now know they will save lives. Patients admitted to a healthcare facility or long-term care home will not be required to wear masks in their rooms, but the policy is now in place for everywhere else. Meanwhile, back in New Westminster, Sina Muscati gets ready to head back into the NICU to sit with his 2-month-old babies.
They're doing very well. We're hoping that they'll be home, they said now in December.
Deborah Goebel, CBC News, New Westminster.